So welcome everybody. As Jamie said, there's a number of topics we're going to be talking about today. Medication management, in particular, electronic national residential medication charts, which will be towards the end. So first of all, we're going to talk about the relationship between My Health Record, digital interoperability, and reconciling medications. So the end game around this digital integration across industry, at the end of the day, is about digital interoperability to enhance clinical practice. So digital interoperability refers to the ability of different digital systems, devices, and applications to connect, communicate, exchange data, and use the information that they exchange. It enables seamless information flow between various platforms, facilitating efficient communication, data sharing, and collaboration. Essentially, it's about making sure that the different systems can talk to each other without needing any special effort from the user. So welcome to My Health Record. Having access will support reduction with clinical errors. So by now you should have already be aware of the fundamentals of My Health Record due to previous training that we have delivered in other sessions, such as what is My Health Record and how to register, understanding the privacy, security and legislation, and also the one that we specifically did on enhancing clinical practice. So if you need to recap some of those other topics, please find other short videos on WAFA's YouTube page or navigate to the digitalhealth.gov website. So let us now discuss some clinical applications. So on the left-hand side of the screen here, you can see what we note, a list of some of the clinical tasks that are commonly undertaken during any given day, things like medicine and medication reconciliation, taking resident history or conducting a resident assessment, requesting tests or scans, and discussing end-of-life decisions. So any of these scenarios potentially can lead to the need for medication being administered or medication to be noted or referred to. On the right-hand side, you will note how My Health Record can actually support those clinical tasks by sourcing up-to-date and relevant information. For example, medication and allergy information can be accessed via the Consolidated Medicines View. Within My Health Record, this provides key information that can help facilitate those reconciliation tasks. And we know that this in turn plays an important role in reducing potential medication errors. During an admission to a residential home, to provide is another very key time to tap into My Health Record, and this provides person-centered clinical care. It is a requirement to gain access to a resident's medical and medicine history. For example, access to the clinical data held within a shared health summary that the GP would upload, or a discharge summary that is uploaded by the hospital, can help facilitate completion of any assessments needed for the aged care staff, which saves time having to collect that information from other sources or having to rely on the resident's ability to be able to recall their medical history, whether that's from a medical or a medicinal perspective. So linking My Health Record to the eNRMC. So the eNRMC is going to be the shortened terminology that we use for Electronic National Residential Medication Chart. And I just want to give you a bit of background on how that comes together. So in 2018, the Royal Commission into Aged Care and Safety was established to investigate the quality and safety of aged care in Australia. This was established following multiple incidents causing serious harm and deaths to residents in multiple Australian residential homes. In 2021, the Commission delivered its final report and made up to 148 recommendations for the fundamental reform of the aged care system in Australia. Out of this came in particular two recommendations that I want to talk to you today, which apply here. So these are recommendations number 64 and number 68. So recommendation 64 indicates that increased access to medication management reviews is required. So the Australian government should immediately improve access to quality medication management reviews for people receiving aged care. So this is one of the recommendations that was put into place. So one of the main points was you needed to allow pharmacy to be able to conduct reviews of medications for residents that initially came in on entry to residential care and then annually thereafter, or if a care need changed, they needed to have access to that medication. Also, they needed to amend the criteria for eligibility for residential medication management to include not just people that are in residential, but also those that are either in respite care and in a transitional care program as well. Monitoring quality and consistency of medication management reviews was a key factor. And recommendation 68, so this indicates that universal adoption by the aged care sector of digital technology and My Health Record was something that they put on the agenda, which means that every approved aged care provider, who are delivering personal or clinical care, needed to make sure that they had a digital care management system, including an electronic medication management system to go alongside that. And it had to meet the standards set by the Australian Digital Health Agency, and that they were both interoperable. So the medication management system and the My Health Record system had to be interoperable. The Australian Digital Health Agency immediately prioritises any support for aged care to make sure adoption is taken nationally across the whole sector. So next steps around specifically My Health Record. At this time, we just want to check whether you have registered yet. If you haven't had the opportunity or you need more information, there's definitely some links that we can provide around how you can do that. If you are already registered and are just beginning to use it, understanding what all the clinical scenarios are around how to best use it, how to get the most out of it, and we can most definitely link you up with those sessions that we've already provided on that information.